It's time for another new Kansas City Spotlight. Here's your host, Lauren Scott.
October is Breast Cancer Awareness Month, and did you know that breast cancer is the second leading cause of cancer deaths among women and the leading cause among Hispanic women? I'm Lauren Scott, your host for Kansas City Spotlight, and today I'm going to be joined by Dr. Lee Norman, the Senior Medical Director at Optum, to discuss the importance of being aware of the symptoms, knowing the risk factors, and steps we can take to improve our health. There's been a lot of advancements in the diagnosis in breast cancer and treatments of breast cancer. So how prevalent is it really in 2022?
Breast cancer is a really big deal. In women, cancer is the second leading cause of death in women, and breast cancer is the second leading cause of cancer deaths in women. Hispanic women, it's the most common cause of cancer deaths, and African American women, it is much more prevalent than in non-African Americans. It's a really big deal.
So why are some women more prone to getting breast cancer?
There are certain genetic differences from person to person that make them prone to ovarian and breast cancer. Also, people with a strong family history of breast cancer. So those are the ones that we particularly worry about when it comes to screening.
Now, how can someone know if they've developed breast cancer?
Great question. There can be, at times, no changes at all in the breast and no changes in a person's symptoms. So it can be just a completely normal person that develops breast cancer. But oftentimes women will feel a lump in the breast, they'll see changes in the skin, discharge from the nipple, tenderness in the armpit area, a lump in the armpit area. It's really important for women to do self-breast exams on a regular basis, because usually there will be some kind of a minor change, a little dimpling or retraction of the skin. Do not blow those things off as being insignificant. Any change in the breast is something that needs to be checked out.
Now, what are some recommendations that you have for the typical breast cancer screening?
There's a variety of recommendations. It's not complete agreement, I'll say, but the U.S. Preventive Services Task Force recommends every other year in women 50 to 74. Younger women 40 to 50, I think well can be considered for it, and a woman of any age in that risk category that I talked about earlier.
Okay, all right. So if people want to learn more about this topic, how can they find out more?
OptumKC.com is a great place to go.
All right. Well, thank you so much for being here with us today. It's all great information.
Thanks, Lauren.
This Kansas City Spotlight has been paid for by Optum. For more information, visit OptumKC.com.